Dear friends, I'm Yann, the Chief Executive Officer of the European Organization for Rare Diseases, EURORDIS, and also the Vice Chair of the European Union Committee of Experts on Rare Diseases. It is my privilege, on behalf of EURORDIS, to express our strong support to all people living with rare diseases on the occasion of the Rare Disease Day 2012. EURORDIS today brings together 500 patients' organizations from all over Europe, 45 countries. Together, we speak with one voice at the European level and national level. National alliances of patients' organizations play a key role in voicing the needs of people living with rare diseases at the national level, but also they work together in this European framework. Part of their efforts is to join forces together with EURORDIS to create the Rare Disease Day in 2008, a day created to raise awareness about the needs of people with rare diseases and to promote it as a public health priority at national and European and international level. As part of these efforts, the European Union has adopted a Council recommendation for actions in the field of rare diseases in 2009, which provides for the development of national plans by every member state before the end of December 2013. Therefore, this Rare Disease Day 2012 is crucial. We are only or less than 2 years before the deadline for the development of these national plans. Rare Disease Day has been launched in 2008 in order to raise awareness to the general public and to the policymakers about the experience, the day-to-day life, and the needs of people living with rare diseases. Rare Disease Day has grown rapidly with thousands of events taking place, reaching out to hundreds of thousands of people and resulting in a great deal of media coverage. For 2012, we collectively decided to pick up the theme of solidarity. And this is timely. And we have a slogan, rare but strong together. This slogan expresses the need for solidarity between the different rare diseases and people affected by these different rare diseases across, together with their relatives, family, and carers, as well as healthcare professionals and all stakeholders together. It also expresses the need of solidarity between society at large and people living with rare diseases. Because people living with rare diseases are one of the most disadvantaged category of population in every of our countries. And this for centuries. This is the situation we're trying to change. With this campaign on Rare Disease Day, we hope to promote the value of solidarity in society so that society provides for the care and the financial support for people with rare diseases in order to implement better policies for them, in order to improve access to information, diagnosis, care, treatments, medicines, and also research. We hope to see many of you for the next European Conference on Rare Disease and Orphan Products, which will take place in Brussels in May from the 23rd to the 25th. There will be plenty of capacity building activities for patient advocates and then 2 days of intense discussion on policy of the European Union in the field of rare diseases, international initiatives also, situation on the national plans and progress, with concrete discussions on centers of expertise, on strategies for access to diagnosis, on organization of cross-border healthcare, research policy, and patient empowerment, access to orphan drugs. And we expect to have different stakeholders, around 800 participants, and many of you. We wish you an excellent Rare Disease Day and event today. Thank you.